What are some intestinal obstructions?
The three.
You're talking about the volvulus, the intussusception, and the other one was
Strangulated.
Yeah, that one.
Perfect. Those are some of them, and then also we can have like a bowel obstruction.
Paralytic ileus.
Which what is that?
It's where it just like peristalsis doesn't work.
Perfect. We can have something called what is it called? Adhesions. So you know the mesentery that connect everything together in the abdominal cavity, they can grow too much and then cause an obstruction in the bowel. So what's the difference between strangulated hernia, volvulus, and intussusception? Don't look.
Volvulus is like twisted.
Good.
Strangulated, that's like when it's like tied around each other, and then
That's when you've got a hernia, so it's poking out of the abdominal wall, and the muscle blocks off the circulation to it.
And then the intussusception is where it like goes into itself.
Yeah, the way that I remember that is inception.
Inception.
It's just like inside each other.
Intussusception.
You've got an inception of the bowel.
Inception.
It's like intestine.
Intestine inception. That's good. Okay, now I'm gonna remember that forever.
I hope so.
Especially because I like that movie.
It's such a good movie.
it is a
It
good one.
is. It's awesome.
Speaking of inception, what are we going to see? What signs and symptoms will we see with an intestinal obstruction?
Constipation,
Yeah.
Nausea,
vomiting, probably.
bloating.
Oh yeah,
Like
well,
hyperactive bowel
Okay.
sounds above.
Good.
And the Borgies.
Yep. And what is that one called? You said Borgie?
borborygamy.
However you say
Do
it.
you like practice that? I'm impressed.
He practices in front of the mirror every morning.
Borborygamy.
Borborygamy.
So what is borborygamy?
It's like the grumbles.
Oh yeah, the sound.
The high-pitched sounds, especially
Sunday.
closer to the obstruction.
The grumblies, tumbly.
Rumblies.
And even sometimes, especially in skinnier patients, if they've got a serious bowel obstruction, you can see peristalsis waves on the stomach before the obstruction, because the stomach or the intestines are just trying to push everything through that it can, and then afterwards there won't be any peristalsis. Any kind of obstruction can also cause hiccups, because it just increases stimulation to the phrenic nerve. It's kind of weird. So what are we going to do to diagnose an intestinal obstruction, other than the fact that they're not pooping? X-rays? CT, good.
CBC
What is the CBC going to do?
detects any bleeding or infection that may be causing it.
Perfect. Good.
Chemistry studies. So this is
That's mostly just looking for fluid imbalances.
so that happens like if you know you have an obstruction and then you want to check like the CBC and but it's not really diagnostic.
No, the X-ray, the CT scan, and the CBC are more it's more the X-ray and
Just
the
the
CT
CT
are more diagnostic. If it's lower, we can do like a
Endoscopy.
colonoscopy, but it's probably not going to be that low down. Usually it's in the small intestines, because the small intestines are small, obviously. Can
And
easily
they're-
or twist. So
How's that go again?
That's what they do.
So why do we put an NG tube in somebody that has an intestinal obstruction?
Because of the
They're
start
backed
throwing
up.
up poop.
It can if it's that backed up, but
Yeah,
that's
can't
pretty
it cause
backed up.
like the fecal vomiting or
Yeah. Another reason that we do NG tubes is because we have got an obstruction and we don't want to keep on feeding them and making the obstruction worse.
So would you give them like TPN like after a while? Yeah.
If we need it just kind of depends on the patient, if we need it, then they'll give it, but,
Like you can go like a day or two, maybe NPO, but that just sucks.
yeah, that would be terrible. All right, what is, you might be tested on this, I don't remember. What's the difference between a Salem pump and a Levin pump?
There's the lumen. And the pigtail, the blue pigtail.
Okay, that's what I was looking for, the pigtail. So, with a Salem pump,
That's
You
the
can
blue
put
tail.
it on continuous suctioning because you've got the pigtail, the blue, so it kind of got your NG tube that goes down, and then you've got this little thing that you're like, you're supposed to not occlude it or whatever. And so you can have that on continuous suctioning because that doesn't have a risk of as much of a risk of attaching to the bowel wall and causing an ulcer. The Levin pump is just
Intermittent.
so
Even
intermittent.
with like the Salem sump though, I've never seen one on continuous.
Neither have I.
But the difference is the
Pretty
pigtail.
sure that's whenever it's
Yeah.
hardcore, and then you get out super quick.
Yeah.